In this video, we're going to demonstrate how to perform the manual muscle test for hip extension, which will be testing the muscles of the gluteus maximus and hamstrings combined. We'll also show you a test to bias and preferentially test the gluteus maximus. So in the first position, we're going to assume he's gone through active range of motion on his unaffected side, his left side, active range on the right side, and he's gone through the range while I'm palpating. I can either palpate a gluteus maximus or the hamstrings muscles. Finally, I'm going to perform the MMT and apply resistance. For this muscle group, because it is quite a strong muscle group, hip extension is a strong movement itself, we're going to apply resistance with the longest lever arm that we can to maximize our mechanical advantage in most cases. So I'll show you what I mean. So Eric, can you kick up towards the sky for me? Perfect. So I'm going to apply my resistance close to the ankle. I can stabilize on the pelvis, and I'm going to ask Eric to hold. So hold there. Hold, 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 hold. Good. And as you can see, that's a pretty strong amount of resistance that I'm applying because those muscles are quite strong. So in order for him to attain a grade of 5, he's going to tolerate maximal resistance. For a grade of 4, he'll tolerate moderate resistance. For a grade of 3, he's going to just move through that range of motion but not be able to tolerate any resistance that I'm applying at the ankle. For grades of 2 or 1, 1, we would palpate. 2, we would have him in side lie. I'm going to demonstrate that in a second. So with a straight leg, that test is for the combined efforts of the gluteus maximus and the hamstring muscles, semimembranosus, semitendinosus, biceps femoris. In order to bias the gluteus maximus, as I mentioned, I'm going to have him bend his knee to 90 degrees, and I'm going to have him kick the sole of his foot up towards the sky. So kick up, good. Hold nice and strong there. Hold, 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 hold. You can see, again, I'm applying a lot of resistance. Grading is the same for that. So 5, maximum resistance. 4, moderate resistance. 3, moving through the motion. 4, gluteus maximus muscle test. The only reason that you would move from the ankle to the knee for the combined test, maybe if an individual has significant knee pain as you're pushing on them, or they could potentially have a below the knee amputation, which might necessitate changing to a shorter lever arm. But barring any of those extreme examples, we're going to want to apply resistance at the ankle. So for a 2, we are going to change position to gravity eliminated position. So I'm going to have him lie on his side for me. And I'm going to come around to the back, and all I'm going to do is just cradle the leg and see if he can perform that hip extension motion. And I can stabilize a little bit on the iliac crest so that he doesn't roll in or out of that side leg position. So Eric, can you kick back for me and keep that leg straight? So you'll see how he's kind of cheating and rolling. Can you kick straight back for me? Perfect. So if he moves through the full range, that would be a 2. I'm going to bend the knee. Now this would be the bias position for the gluteus maximus for a grade of 2. Can you kick back towards me? Good. And I'm just supporting the weight of the leg. That would be a grade of 2. Again, 1 would be palpating some muscle contraction. 0, unable to palpate muscle contraction.